Hi, my name is Dr. Melanie Akinyi. I am here at the Clutch Foundry AI and Health Hackathon, and I'm so glad to be part of the winning team. Woo! Preg map to the world. Yeah, so very excited about that. To be completely honest, I came into this only looking to upskill. So right now we're in the transition period between finishing medical school and then starting your medical internship. So we haven't been posted yet, and I had a lot of free time on my hands. So I was like, what can I do in the spare time that would actually help me increase my skills and, you know, be more than just a medical practitioner? And I found out about this hackathon, and I was so excited because AI is such a big thing. It's really up and coming. And I was really excited to be part of this and just see what the hackathon would be about. When it came to team selection, to be completely honest again, it was entirely random. Entirely random. I came in with my former medical classmates, so coming in, those are the only people I knew, and I was so used to them, so I'd hang around them only. And then the Clutch team insisted that you guys can't be all doctors in the same team. So I was thrown into this team with these software developers that I did not know. But it actually has been such a blessing in disguise because we got to interact, and I met so many people that I would not have met had it not been for this hackathon. So I'm bringing ideas around here and there and trying to see what best fit for me and my team. But ultimately, we decided that one of the key areas in healthcare that is quite underserved in terms of innovation is maternal health. And it's such a big thing. Like, women are giving birth every day, literally. So it's of utmost importance that we take care of mothers and make sure that from the time of conception all the way to that child getting to the age of even 5 years, we take care of women and their children through every step. So that was how we identified that gap in that area. And it's actually such a huge gap. You know, you wouldn't think that antenatal care is something that there'd be such a big challenge with. But unfortunately there is here in Kenya. So we found that opportunity and we decided to tap. Essentially, PregMap is a digital solution that would ideally replace the physical or paper-based antenatal care record system that we currently have. So as at now, in Kenya, to record a patient's data, a mother's data throughout her pregnancy, we have a small booklet. And every time you go to the clinic, the booklet is filled with either the tests that she does or her physical examination findings. And a lot of the time you find that either sometimes a patient comes to the clinic, has forgotten her book, or she lost her book, or her book was swept by floods. You know, the things like that happen, unfortunately. So we decided that in the 21st century, that's unacceptable. There's no reason for us to lose a patient's medical record because we don't have a digital system for that. So that was one area that we really had to tap into. And then another thing was the fact that sometimes women either forget or the distance to a facility is so long that she decides it's not worth it. The cost-benefit analysis just doesn't add up. So we really had to look for a way to ensure that these mothers, because antenatal care is something that is so important in determining how your pregnancy outcome is as a mother. So we decided that we really had to tap into that and find a way to ensure that mothers are getting the minimum required antenatal care visits. Oh my gosh, how much time do you have? There's so many things, so many things. And I continue to learn every day as I'm here. Every time I come out of our sessions here at Clutch Foundry, I come out with so many, not even one key takeaway, multiple. There's so many things I didn't know, from how to conceptualize a problem, identify a problem, conceptualize a solution to that problem that actually makes sense, that is feasible in the market today. Because you may have an idea, but when it comes to looking at it realistically, it's not viable. No one would take it up, you know? And then finding a way to combine AI into your typical solution takes it from here to here, genuinely. AI is such a great, I think it really blows my mind to this day. And I don't think I'll ever get used to it because the potential for solutions with AI is endless. So there's so many things I come out of here with every time I'm here, and I'm very grateful. Meeting up at Clutch, baby, because it's always good vibes here. Everyone at Clutch has been so lovely. Meeting people from the other teams as well. It's such a mesh of so many different professionals, and I'm actually very grateful because having gone through med school, we tend to be in that bubble and cocoon. So honestly, before this, my contact list was mainly doctors. At least now I have lawyers, I have software engineers, you know? So it's a nice way to meet people and actually build solutions that affect our field with other people as well, you know? So that collaboration is something that I'll probably miss, but I don't think it's the end. I'm hoping it's not the end. Of course, we were hopeful that, you know, we would win, and I'm glad that we did. But in the events that we didn't, I don't want to sound ungrateful and say that winning has not been, you know, a blessing to us. But I'd really like to say that even in the events that we didn't win, I think we would still push PregMap onto the market, because it's something, even when before the final judges, before the judges came together and deliberated and announced the winners, each one of them told us that our problem was something that is so relevant and something that has the potential to have a really great impact. So even like just with that insight, it was clear to us that this is not something that we can, you know, develop for the hackathon and then leave it here. So I know for sure that we would continue developing it, even in the event that we hadn't won the hackathon, because it's something that has the potential to change so many lives. And maternal health is actually quite a big area in public health, you know. So it was definitely something that we would always continue building. What I want to leave you with? Of course. So one parting shot is for anyone who's thinking about stepping out of their comfort zone and delving into an area that, you know, you've never delved into before, do it. Do it. Go for it. I know it might be scary coming from an introvert, trust me. But you don't know what you will unleash and unlock, you know? And not only will you be developing personally, you have the potential to change other people's lives as well. And that's what we're doing through PregMap. So watch this space. Watch for PregMap. A lot of thanks, yes, of course, to the Clutch Foundry team for making this amazing hackathon a reality. So much love for you people. Vote of thanks to my teammates as well. Those people have worked tirelessly, and I'm really grateful for it. A vote of thanks to myself as well. You know, I've really done my big one and stepped out of my comfort zone, and I'm glad it paid off in more ways than one. So yeah, signing out.